Hello and welcome. Thank you for joining me outside today. We're going to do a practice today on releasing the stress and tension that we hold in the middle of the body, particularly around the psoas muscle. This is going to be a slow, nuanced, subtle practice, not a big, fast practice. If you want that, go to a different video. I'll make a suggestion up here. But if you're into this unwinding, this is going to be more of a letting go than it is anything else. So we'll do just a quick, I want to give you a quick brief anatomy lesson on where the psoas lives in the body before we actually start to move in a way that, or not move, in a way that will help with this. So the psoas muscle, basically it's like two pillars that run inside your front hip bones and outside your navel. So they're kind of like, you could picture them almost like parallel columns, and they attach to, it kind of spreads along either side of your spine and attaches to the 12th thoracic vertebrae. That's your your lowest floating rib. And then all kind of attached to the sides of your spinal bones from that T12 through all the lumbar bones down to your pelvis. So it's almost like fingers of this like tube or trunk that comes out and attaches. And then this tube runs along either side of your spine, and it intersects into the pelvis, and it's kind of woven together with the fascia and with the iliacus, another pelvic muscle. And then those come through diagonally in the pelvis forward and attach at the upper inner thigh at the lesser trochanter. So this is, if you were to see it from the side, it's kind of running diagonally from the lumbar spine and T12 low rib through the pelvis and out to the inner upper thigh. So that's the area we're going to be paying attention to. I know that was a lot of detail, but hopefully that will help you to understand. Lizzie, lie down. Okay, so I'm on a crash pad here, which is actually a really great tool for this. And the point is that you're going to be lying down for most of this. And I want you to be lying on something that is firm, like the ground. Like, don't lie on your bed. But isn't so hard that it's hurting your bones. So maybe if you have like a hardwood floor, put a blanket or something underneath you. And when you get to lying down, head, hips, feet, all on the same level if you can. Elevate the head if you need to. Bend your knees, put your feet flat on the ground. And if your knees feel like they're going to splay open, separate your feet a little wider and just tip your knees in so that they rest on each other in like a pigeon-toed way. And this practice, as I mentioned, is not a fast doing practice. It's a not doing. This is a not doing practice. So right now, all you're going to do is let go as best you can. And you're just going to be patient, because the mind will be jumping ahead and wanting to do. And right now, what we're wanting to imagine is that the bony structures, like the bowl of the pelvis, they're stable, right? They're not really moving, they're set there. But these two pillars that run just inside the hip bones, but a little outside the navel, can rest or relax down back into the pelvis. And this is often, for some people, it's very nuanced. It doesn't feel like much is happening. But for some people, there's quite a lot of release. And like in my case, I'll feel it in my head and neck and my shoulder as well. So just pay attention in your body for the next few moments to anything that you may feel, especially if it's between the top of your leg, especially where that inner thigh area joins the pelvis, and the band of your lowest ribs, all the way around, not just the front. And you don't need to force any deep breathing or anything like that, but just maybe use your breath to help you relax. So just focus on a few exhales. And you know, if things don't let go, trying to force it to let go is actually not going to work. So just move on in your mind from that. Just take a step back and let it be. This area of the body it's a trunk, like a spinal flexor. It will either bend your spine forward if your legs are fixed, or it will flex your hip, which means like it will pick up your leg, your knee forward if your torso is fixed. So it's involved in a lot of actions that we do. It's also just involved in standing, stability, and like where we are in space when we're standing and how we're standing. But this muscle is also triggered when we're having a lot of stress and anxiety or the fight or flight response. So let's give it like maybe 30 seconds more, and I know you might be bored mentally, but just try to give your body this gift of waiting, just waiting until something may happen. And now we're going to begin just a subtle pelvic tilt and tuck. So when you breathe in, you're going to let your low back, or tilt, push your low back up off the mat and push your pubic bone down between your legs toward the floor. So essentially kind of lengthening the front of the psoas subtly, very subtly, moving the inner thighs away from the head. And then as you exhale, you're gonna first just relax back, and then a slow, subtle tuck where the abdomen and the psoas draw down, kind of flattening and widening your back as your tail lifts up. And just try to lead with the breath so that you inhale first, and that sort of pushes the pelvis into this tilt. Both sides of the pelvis pushing down into the mat or the floor or the crash pad if you're like me. And then exhaling, relaxing to neutral, and then just checking that when there is any engagement of the front of your body, that it's drawing in, it's like knitting in, it's not pressured to push up. If it's pushing up, then you've gone too far. Something's not working quite right. So let's do one more of those. These are very slow. Allowing for enough softness when you inhale and tilt that the head even responds with like a ripple of movement. And then the last time, exhaling, just relaxing your spine, relaxing the psoas, relaxing the waist, and then drawing deeper, just a subtle engagement of front body toward back body. And then you're going to go to neutral, and you're going to roll onto your side. And you're going to pause, just don't rush. So if you were to kick with your legs, it would kind of jar this area and be counteracting everything you just did. So try to keep your legs really heavy, and push with your hands and roll up through your spine. And then once you're upright, see if you can sit in a way that's symmetrical, like maybe with your feet outstretched or with your feet tucked under and your knees bent. And just take a moment where you feel this area at the top of your thigh, and you want to imagine almost like gravity's heavier there, that it's just grounding you. And while the column of the spine, that's right in the middle, might be drawing in and up in its natural lumbar curve. On either side of the spine and at the lowest floating ribs, soften just slightly back so that the kidney area is less gripped and there's a little more length for the iliopsoas. Let's take one full breath and then exhale. Okay, this is one of those things. It might not feel like you did much while you were here, but just notice as you go on about the rest of your day if you do feel different, and if so, how. I feel like way more, like everything's slowed down and I'm moving through honey now. But maybe you feel differently. Either way, thanks for joining, and I look forward to seeing you next time.